Now, this piece in The Australian caused all sorts of discussion in the office. The paper reported on the world's most comprehensive study of exercise and depression, which had found that physical activity, even at low intensity, had about double the effect of antidepressants on improving low mood in the short term. Joining me now to discuss this further is psychologist Clare Rowe. Claire, this wasn't some little junk study. This was a high-quality, comprehensive review led by Australian researchers. It was published in the British Medical Journal. What does it mean for people who are being prescribed antidepressants? Are we going to rethink how quickly that's happening?
Hi, Rita. Well, I certainly think that we should be, and there's a lot of professionals that have been calling for that for a long time. Now, first of all, don't get me wrong, if anyone is listening to this and on an antidepressant, we are not advocating that they stop that antidepressant. And antidepressants, like what they call SSRIs, have a very critical and crucial and a good place in our conceptualisation of how to treat mental health. But what's been happening is that for a number of decades now, we have been having a very narrow view of what mental health or poor mental health is. And that's been based on a very medicalised view. And I think that's helped us because we've kind of put it in that box of a chemical imbalance. We should be seeing it just like a physical disability or illness, and that's helped destigmatise it, right? And so having that very narrow medicalised view has meant it goes hand in hand with treatment from a doctor, i.e. medication. But what has happened, and I think this study will confront a lot of my colleagues in saying that I think a lot of psychiatrists, psychologists will hear people treating depression with diet and exercise as very alternative fringe stuff, whereas in fact it should be the absolute frontline first recommendation before a script is made for anyone.
Well, you talk about that medicalised view, and increasingly I think we are finally discussing the issue of medicalising normal human reaction and emotion. You hear about people being prescribed antidepressants who are going through a difficult time, but you can understand why they're going through a difficult time because they may have lost a loved one, or they may be going... I've even had friends talk about their children going through Year 12 exams and being stressed and being prescribed something, and you think, well, that's a normal human reaction, isn't it? Is this an issue that needs far greater scrutiny? Just how many people are getting medication when perhaps there is another solution that could work better for them?
Yeah, absolutely. Okay, so a couple of things. The first thing is, how do we as professionals assess what poor mental health is? It's actually not the absence of negative emotion. It's actually not happiness. Someone who feels happy all the time is not the benchmark that we use to say, do you experience good mental health? It's actually when you do have those feelings, and we all have them, whether it be worry, anxiety, sadness, anger, how well do you cope with them? How badly do they impact your day-to-day functioning? What's your resiliency like to respond to them and get through your day? And that's how we assess your functioning. And so, yes, the presence of negative emotions should be absolutely, first of all, normalised. And second of all, there is very good research now, and this study adds to it. I mean, there's a wonderful work coming out of Harvard Medical School at the moment about conceptualising poor mental health in terms of the whole body in a holistic way as a metabolic disorder of the brain. And we know that physical movement changes the neurology of the brain. It can change it instantly. I have had clients in this space behind me, teenagers, and the first thing I've done is put on music and I've got them up dancing in the room. And people think, oh my goodness, this isn't talking therapy. No, but the research is telling me that it does more for them than anything else. So that's what I'm going to go to. And so I think, Rita, this is a symptom of our busy world where a GP who is pressed for time, who has patients waiting for them, knows that the person in front of them is not sleeping, is not eating well, is not moving their body, is scrolling on social media. But the idea of changing all that is very difficult Very, very difficult. And it is easier to write them as a prescription. And I don't mean that as any detriment against general practitioners, but it perhaps should be scrutinised in the quantity. Australia uses one of the top users of antidepressant medication, and a huge chunk of that is under 20-year-olds. And as a frontline intervention for all mental health, we should be looking at what we're putting in our mouth, how we're moving our bodies, how we're connected to people, and how we're spending our time. And that should be the frontline go-to first, not as a secondary afterthought in conjunction with medication.
If we've got an increasing percentage of under 20s on these sorts of medications, is it a short-term fix, or is there a danger that once you start down this path, you're going to be medicalised for much of your adult life?
Yeah, there is a danger to that. I would say that the children, and there are children under the age of 12 on antidepressants, the children that we would typically see on these type of interventions, we try and keep it as a short-term intervention. We say to them, right, we're going to take this for 12 months. And in the meantime, we have to make these changes in your life, in your family relationships, in your day-to-day diet and exercise, so that when we take you off these medications, we've got that in play. So they're used a little bit more as a crisis, really last resort, I would hope, for young children. But by the time you get into teenage years and definitely into adulthood, I think there is, certainly for mild to moderate depression, the risk of putting people on these medications does let them know that you have this medical condition, perhaps a brain imbalance of chemicals. And so it does breed, I fear, this sense of helplessness, that there's nothing else that you can do about it. And the reality is so far from the truth. The simple changes people can make in their lives to take control of their mental health can completely empower them and give them control over their treatment, rather than giving a message to a 16-year-old that, here we go, you have this thing wrong with you, take the medication, throw your hands up, and you don't need to make any other changes. And I think for any age, that is absolutely the wrong message to be giving.
Now, we know exercise has an enormous impact. You've mentioned music. Just quickly, what else would you recommend to some of your clients to shift their mood, to make them feel better before they consider medication?
Okay, so this study confirmed, I've been saying this for a long time, that any movement is better than none. So when you're not feeling great about exercise or you're experiencing depressive feelings, the overwhelm of going out for half an hour, 40-minute run or going to the gym, I mean, it's not going to happen. I'm not depressed and it's not going to happen for me. So anything is better than nothing. So 10 minutes of strolling outside is better than sitting inside on your phone. So stretching, so yoga, but again, you don't need fancy yoga gear. You don't bend down and touch your toes, stretch up. So any gentle 10-minute movement a day is better for you if you're doing nothing at all. And the second thing is there's a lot of research about getting outside first thing in the morning, vitamin D, sunlight on your face, instead of the blue light from your phone. So get the phone out of the bedroom. The first thing you do is you wander outside, front door, out on your balcony, and you get some sunlight on your face, have a cup of tea or coffee in the morning, then go check your phone. Do that after.
That is excellent advice there. Clare Rowe, thank you so much for your time this evening. Really appreciate it.